Hi, my name is Dr. Joe Caperna. I'm going to review ACT HIV 2025, the American Conference on the Treatment of HIV. It's one of the largest clinical conferences on HIV in the US. Many clinicians go from all levels, nurses, social workers, psychologists, therapists, dietitians, we saw physical therapists. Wanda London is going to present with Jen Lethridge on original research that they presented at this conference. I'm going to go over top 8 highlights. First was they summarized the probably 10 cures. The last one was announced at CROI this year. They talked a lot about the GLP drugs like Ozempic and the muscle loss from it. And be careful, that was a highlight there. But they work. They especially help for fatty liver specifically in HIV and weight loss in HIV without diabetes. And we know that at a certain weight, there's increased heart attack, stroke risk, diabetes risk. There was a lot on PrEP and a lot on it not getting to people of color and an explanation for the high rates of HIV in some groups. A lot on protecting the heart with statins. Anal cancer screening prevents cancer if it then goes to a high resolution endoscopy. A lot on diabetes and HIV, and that there's many new drugs. Wanda was interested in the hair loss from COVID and a lot on community involvement, which I hope will continue, and that's why you're here today. Tumor cures were reported at CROI 2025, which brought us from 8 to 10. And these are the years of the cures. 2009, we went 10 years, and then we got a clump of 4, or excuse me, 5, and then 1 in 2024, and then 2 this year. There's details on each of these topics that you can go through. We're going to post this PowerPoint and a more detailed PowerPoint. There's about 14 slides here. Make sure to talk to your providers about heart attack, stroke risks, and the use of statins. Make sure you ask about an anal pap smear. Men, women, transgender people, everybody who is living with HIV should get a anal pap smear. Hair loss, there was a UCSF dermatologist that mentioned minoxidil is very effective, she's found, for 3 to 6 months. A lot about community involvement, and a lot of surveys, but there was one study, PILLAR, PILLAR, which involved treatment with every 2-month aptitude, and it was community-based. We've already published 2 surveys that Jen and Wanda are going to review next. And I think that we should consider a local survey every year so that the local community can voice their needs. So thank you very much for your time. There's still a little bit to go.